The City of Ottawa is copying the province of Ontario, declaring a state of emergency locally.
Today I'm announcing that we're declaring a state of emergency for the City of Ottawa in response to the increasing spread of COVID-19 in our community.
The state of emergency will allow the city's manager, Steve Kanalankos, and his team to deploy emergency operations in a quicker fashion, Watson said, adding it will more easily allow the city to purchase medical equipment it requires.
Moving to this state of emergency to ensure that we have the tools available to protect our healthcare workers and our residents. We need these tools to support our social service agencies, helping those living on the streets, and the thousands of nurses, doctors, and first responders fighting this fight.
It comes at a time the number of COVID-19 cases are on the rise in Ottawa and throughout the province. On Thursday, Ontario had 170 new confirmed cases, a 25% jump in a day, bringing the total number of cases in the province to 858. 5 new COVID-19 cases were reported in Ottawa on Thursday, bringing the total number here to 32 confirmed cases. The new cases include 2 men in their 60s who had been to Spain. One is in hospital, the other is self-isolating. It also includes a woman in her 60s who had been to Egypt and Dubai and is now in hospital. A woman in her 40s who is now self-isolating. Officials don't know where she contracted the virus. And a woman in her 70s who had been in close contact with another confirmed case and is now self-isolating. Ottawa also reported its first COVID-19 related death on Wednesday, a man in his 90s who went to the Ottawa hospital only 5 days ago after showing flu-like symptoms. He was quickly admitted and had no recent travel out of the country and is most likely to have contracted the virus through community spread. On the same day at Council, Dr. Vera Etches said there was proof it's spreading through close contact in our communities, stressing again the importance of self-isolation when sick and physical distancing all the time from others.
We are seeing more people where there is no history of travel and that the exposure to the infection has happened in the community. Again, at the federal level, they were describing this as well, that up to half of the cases now cannot be linked to travel, and so it's evidence that there is spread of the virus in our community.
The city's manager, Steve Kanalankos, said they have been working with Ottawa public health officials to stop the spread of the virus, saying it's difficult to predict what will happen next and how to recover once this crisis is over. He referenced 2 other state of emergencies the city declared, including during the recent tornadoes and floods, saying this is a very different situation.
It's a very unique situation compared to the number of things we've been involved in, from ice storms to multi-day blackouts, floods, tornadoes. Don't forget, we were heavily involved in SARS and H1N1, and we learned a lot from that, but this is very different. It's changing day to day, and we're trying our best to look forward and focus on the right things.
OC Transpo has implemented a number of health and safety measures, including taping off the front of their buses, allowing rear door boarding only. They know it will mean a loss of revenue, but say it's an important precaution to keep their drivers safe. It comes at a time ridership levels are already down roughly 75%, with most employers allowing their workers to work from home. As a result, OC Transpo is reducing the number of buses they have on the roads. Dr. Vera Etches says we could have as many as 4,000 unreported cases within the city, stressing the importance of social distancing, saying the sooner we do that, the sooner this crisis will be over. Charlie Senack, TWIN News, Ottawa.